Hey guys, so this is a short presentation on the digestive disorders. So the first one is going to be heartburn related to acid reflux. So typically heartburn is due to ingesting things that are too acidic, that are spicy, and it causes the stomach to become too acidic. So what happens is the sphincter at the top, I talked about this with the honors level, the esophageal sphincter of the stomach, which usually holds the acid inside, is actually going to leak a little bit. So it regurgitates the acid back into the esophagus. So some of the symptoms are burning sensation, hiccups. So I know I get acid reflux really bad and I get hiccups a lot. So depending on the food I eat, will depend on if I get hiccups or not. So the biggest treatment for this is just watching your diet. So if you know you have acid reflux, avoid too much acidic or spicy foods, or if you do have those, make sure to have some carbs or something to help reduce the acidity or the spiciness. The other thing you can do is take antacids, basically reducing the pH of the stomach. The next disorder is gastroenteritis. This is also known as the stomach flu. So whenever you see itis, that's going to be inflammation. So this is basically saying inflammation of your gastrointestinal system. So it's going to affect the stomach and your intestines. So this is typically caused by a virus. So that's why we call it the stomach flu, because it's caused by a virus. So some of the symptoms you typically have are due to trying to get this virus out of the body. So it's either going to regurgitate back up by vomiting, or it's going to go out your system extremely fast through diarrhea. So one of the complications from this is dehydration, because in the intestines, one of the major things is to absorb water, but since it's traveling fast through, it's not absorbing the water it should, and that's what's causing diarrhea. Another disorder is ulcers. Ulcers are typically caused by bacteria, H. pylori. Other things that can cause ulcers are your lifestyle. So if you are smoking, drinking too much, stressed, certain medications, drugs, etc., those can cause the sores or lesions in the stomach lining to form. So some of the symptoms you'll get is burning pain after eating. So typically between your meals, not before, because it's during the digestion process that's really going to hurt because of all the stomach acid. One thing that you can do is take what's called an H2 blocker. So this is going to block a receptor that helps to release the hydrochloric acid and make your stomach more acidic. So by limiting that, it's going to reduce the amount of wear in that area. The next one is Crohn's disease. So this is caused by inflammation in the intestines. So this is both the large and small intestines that are affected. It's caused by bacteria that's constantly occurring. So some of the symptoms of this are diarrhea, bleeding, urgent need to go. You might have the opposite, constipation, cramps and pain. I've heard from people I know that have this. It's extremely painful due to the inflammation. So anything passing through, it's irritating. Some of the best things that you can do are watching your diet. So things that help promote digestion. So things like green tea, carrots, ginger, turmeric, etc. And you want to avoid things that cause inflammation. So yet again, things like the spicy food or acidic foods. You can take medication. It's also good to take things with probiotics or good bacteria that help level out the bad bacteria. And then, of course, surgery if needed. Appendicitis, so yet again, itis, so inflammation of the appendix. So If you remember back to bio, the appendix, it's not really sure why we had the appendix. One thought is the immune system, because there is a lot of white blood cells found in the appendix. It's also thought to be a helpful thing for digestion, so maybe to help digest sticks and stones, etc. But the biggest thing that we need to know for today is that this can become infected. So if you notice from the picture, it's basically this little projection off the cecum area of the large intestine. So things can get impacted very easily in that area. So if things get stuck in there, it leads to the growth of bacteria, which then leads to an infection. So some symptoms of this, it's extremely painful. If you've ever had like a UTI or other type of infection, it's going to be similar but way more painful. It causes nausea, vomiting, fever, etc. So the only treatment for this is to remove the appendix. The next disorder is cirrhosis. So cirrhosis is a disease of the liver. For what happens with this is the normal tissue is replaced by fibrous connective tissue. So things that affect this are toxins that the liver is trying to break down. So for example, excessive amounts of alcohol. So the liver is trying to remove the alcohol from your body, detoxify, but if you're drinking too much, the liver can't keep up with it. And it actually causes this disease, which then is replacing normal tissue with different types of tissue, which makes the liver function even less properly. The liver can't function properly, so it can't get the toxins out, and it can lead to liver failure, which is extremely dangerous. Gastritis. So this is inflammation of the stomach itself. So typically this is due to your lifestyle or things that you are using in excessive amounts. So things like aspirin, coffee, tobacco, alcohol, etc. But this can also be caused by an infection, which may not be due to your lifestyle. One really bad symptom is vomiting blood. So then we have food contaminants, so things like E. coli and salmonella, so different bacterias that are going to cause irritation. So for this, if you are ingesting foods that are not cooked properly, they need to be cooked to a certain temperature because you want to kill these bacteria. That's why it's so important to cook meat to a certain temperature. If you do not kill the bacteria, then you risk being infected by these and having symptoms of gastroenteritis. Diverticulitis, so this one is where you can basically get these little pouches or sacs that form on the intestines. So you can see it in this picture here that the colon, or the descending colon specifically, is going to make these little pouches, and then things can become impacted in them. So as the fecal matter is moving through, it could accidentally get stuck in there, and then bacteria is going to build up to try to fight that off, and then it becomes inflamed and painful. So I know my dad has this, so he says it causes like cramp-like pain. It's very irritating. So one way that you can fix this is by taking antibiotics, and of course, if it gets to an extreme condition, you can have surgery. So the last thing, how does vomiting occur? So this is important. You will need to know this for the test, so make sure you write this down. So vomiting is basically your nervous system in full force. So let's say you've ingested something, maybe bacteria or a virus, or maybe it was excessive toxins like alcohol or something. Your body wants to remove this. So once it gets to the stomach, it sends a signal to your brain saying, hey, we got some bad stuff in here. We need to remove it before it gets to the intestines. It's extremely important that it's removed before it gets to the intestines, because the intestines are where absorption is going to occur. So if these things make it to the intestines, now you're absorbing it into your bloodstream and it's getting sent throughout your entire body. So it's very important to make sure you catch it before it gets to the intestines. So, as I said, it's going to send a signal to the brain. The brain's going to send a signal back down to the stomach and the esophagus saying, we need to remove this. That's going to trigger what's called reverse peristalsis. So peristalsis, as we said, is when muscle contractions are going to force the food down to your stomach. In this case, reverse, it's going to force things up. So reverse peristalsis, when that happens, typically you get that like nauseous, like mouth-watering feeling. So that's kind of like your warning sign, like you're about to vomit. So the next step that's going to occur is then the stomach will begin to contract. So that's like when you heave, and then you will vomit. So that is everything that you need. If you have any questions, just email me and I'll help you out.